A lot of times when we see asthma patients, they have been to their primary care doctors, family doctors, urgent care. They've been admitted in the hospital because they're short of breath, or some, especially the young ones, they cannot participate in the sports. Usually parents bring them, or they say, oh, whenever I get sick, I can't breathe. So those are the most common complaints I see when the patient is in. Basically, based on history, we figure out, seems like asthma, we have a specialized way of testing the bronchial airway response by doing a spirometry test or breathing test, we call it. We look at the test results, see how the lung response is to the medication or without the medicines. If that shows asthma, we start the patient on a treatment. There are several treatments available depending on what's the trigger for asthma. For some patients, the trigger is cold air. For some patients, the trigger is environmental allergies or dust mites or dog or cat allergies. For some patients, there is no allergy, but they still have asthma. Based on what is the trigger, we can prescribe those patients a combination inhaled corticosteroids, a bronchodilator treatment. If they're allergic, we can prescribe them immunotherapy. And if none of this has worked, or the patients have tried it in the past, we have specialized biological treatment which are available, which we can offer the patients after doing a careful examination of their blood and making sure the patient qualifies for it. So there's a lot of stuff available in our practice which we can offer to the patient, provided we are able to do all those tests and carefully tailor a specialized plan for these patients.